Since the start of the pandemic, we have worked hard to protect those at high risk of serious complications from COVID-19. Older North Carolinians have been hard hit by this virus, and residents of long-term care facilities are particularly vulnerable. Early on, we formed a long-term care team for COVID-19 response dedicated to working with facilities, local health departments, industry associations, advocacy groups, hospitals, and others on a multi-pronged strategy of prevention, capacity, testing, and managing outbreaks and oversight. Given the risks, the governor took aggressive preventive measures beginning back in March, with restricting visitation and communal activities and requiring employees to be screened and monitoring of residents. We also paid for and delivered to all of our state-licensed long-term care facilities a 14-day supply of personal protective equipment to support facilities as they built up their own PPE supply networks. And we've provided temporary rate increases to help them meet the enhanced COVID-19 infection protocols. We've also helped facilities address staffing shortages by providing temporary workers from the state and provided ongoing training and assistance on infection, prevention, and control measures. In our oversight role, the Department of Health and Human Services is surveying all nursing homes on infection control. Testing is also a key part of our strategy. Currently, all residents and staff are tested when there is one case of COVID in a long-term care setting. We also have begun proactive testing of all staff and residents in nursing homes. We have completed this proactive testing in all state-run skilled nursing facilities, and beginning next week, DHHS, Health and Human Services, will pay for and deploy proactive testing of staff and residents in all private nursing homes. We are announcing today that DHHS is partnering with CVS Omnicare for one-time COVID-19 testing of all residents and all staff in nursing homes across North Carolina. This effort will extend through the middle of August and reach an estimated 36,000 residents and 25,000 staff in over 400 nursing homes in the state. This testing will provide another tool to further protect those who are at higher risk. While we continue to expand testing, it is important to note that commercial and hospital labs across the country, including here in North Carolina, are again running into shortages of important chemicals called reagents that are needed to process tests. As a result, labs are seeing backups in processing samples and are taking longer to provide results. Federal action is needed to help address these supply issues. The department's work is only part of the equation. Everyone needs to play their part to protect their health and the health of our loved ones and our neighbors, including those older North Carolinians, by wearing a face covering. Face coverings are effective when everyone wears them, which is why we took the important step of requiring them in public spaces. Many people who have COVID-19 don't show any symptoms right away. You may have the virus right now and not know it. When you wear a face covering, you protect others around you. That could be someone who works in a nursing home who also happens to shop at your local grocery store or eats at your favorite restaurant. By protecting them, they are less likely to catch the virus and risk spreading it to those they care for in nursing homes. This is so important because we know that once the virus finds its way into a nursing home, it can spread rapidly with devastating consequences for residents. Additionally, as you think ahead to this July 4th weekend, make sure you are planning for ways to celebrate that involve wearing a face covering, avoiding large crowds, and washing your hands often. We need to keep this virus from spreading further. States like Arizona, Texas, Florida, and others are cautionary tales that show us this virus can surge and surge quickly. Our measured approach here in North Carolina is helping to protect all North Carolinians. We don't want to go backwards, And we won't need to if we work together on the 3 W's: wear, wait, and wash. Please continue to take care of yourself and those around you. And with that,